Well, welcome to the CHSP Policy and Practice Provider Exchange. My name's Marika Kontellis, and I'm going to be your host today, and I'm very excited to be hosting a panel of my esteemed colleagues. I begin by acknowledging the traditional custodians of the lands on which we meet. We all meet. We all come from different, or are coming to this meeting from different lands. I am here on Gadigal land, and I pay my respects to elders past, present and emerging. I'd also acknowledge with respect our Aboriginal friends and colleagues who are joining us on the call today. Thanks again. Thanks for joining us. I'm not quite sure if you have been to a policy and practice provider exchange, but this is one of 4 this year. This is the second session, proudly hosted by the Central and Eastern Sydney region here in New South Wales. And I know that some of us are joining us from different parts of the country, so a very warm welcome to you. The whole idea of this policy and provider exchange is to bring together providers from various regions across the land and discuss the issues impacting on our service delivery. We believe collectively that practice should drive policy, and that policy and resource allocation decisions are absolutely embedded in the lived experience of those who are ageing, their families, carers, and of course us at the front line. This exchange today is brought to you by the Inner Sydney region, and if you don't know the Sydney region, I can tell you it is the region where that is most populated region across our country. It is also a region that has the most significant disparity in terms of socio and economic context or status of people. We have some of the country's richest people living in our region and some of the country's poorest people living in our region. And of course, that impacts on how we plan for, coordinate and deliver our services, particularly to older Australians. Whilst we're talking, we need to acknowledge that we're also working in this really strange and reforming context, a context that is not only about aged care, but it is also about healthcare, and it's about social services more broadly. It's also in a context of other geopolitical problems and challenges that we're having right now across the world, impacting on every local community. And I know, for example, that the fuel crisis is impacting on a lot of our frontline services. And if you haven't felt the impact yet, chances are you will. I am really excited to introduce my colleagues in a second, but I want to run through a few little things because we want you to be able to participate and contribute any time. All you need to do, if you want to write something in the chat, write it and we'll make sure we read it. And if so, respond to it or call it out. Better still, if you want to talk, just raise your hand, clicking the raise hand button on your device to join the queue. We'll then invite you to share your question or comment or experience through your voice. There's I said earlier through the chat, I meant the Q&A, and I'll read those questions out on your behalf. Comments and questions will be responded to on a first come, first served basis, but I really want to encourage you to ask as many questions or make as many comments as possible. We are talking about our early entry system and the importance of social connection. And I'd like to introduce my colleagues one by one. First of all, Janet Green is the CEO of J&C. Warm welcome to you, Janet,
Thanks,
and
Marika.
thank you for joining us today. Dina Petrakis, the CEO of Ethnic Community Services of New South Wales. Welcome to you, Dina.
Thanks, Marika.
And Jacqui Oong, who joins us, leads the aged care services for Newtown Neighbourhood Centre. Welcome to all three of you.
Thanks,
Now,
Marika.
I know I did the maths before, and between you, there is over 100
Oh
years
my
experience.
God.
I know, Jacqui. Maybe I snuck myself in there, in and around health and community services. There's been a load of changes. Jacqui, I know I worked with you when our system was called HACK. Presumably everybody remembers the Home and Community Care Program. Well, I'm saying bring back HACK, but maybe that's a bit too late now. But there is certainly a lot of experience in this room, as indeed there is a load of experience across our audience. I'm gonna I'm gonna start with you, Janet, if that's
Sure.
okay.
Yep.
Your organisation, Junction Neighbourhood Centre, J&C, works to support older people in their community every day. I mean, I'm certainly see your service pretty much at every key community event. Tell us a little bit about what you think are the key reasons older people that you serve end up in higher levels of care. And by that, we also mean hospital as well as residential aged care, or even accessing a community care package. And what are these older people living at home telling you matters the most to them?
Thanks, Marika. It's great to be here today, everybody. So our organisation, Junction Neighbourhood Centre, or JNC, we've been around working in our community in East and Central Sydney for 52 years this year. So it's been a while. And I guess we've got a kind of a wealth of feedback from the communities we work in. Marika mentioned in the intro that there's a huge sort of diversity of in this community, and in the areas that we work in, there's particularly a large number of people who are very well off, but there's also the largest social housing estates in New South Wales are based in the region that we work in. So we work, and our organisation tends to focus on working with the most vulnerable people in the community. So sorry for that intro, but just to get back to the question, I think the question about the key reasons why older people end up using higher level care are kind of quite multifaceted. There's barriers in place. There's barriers in the systems that to prevent or to make it more challenging for people to access some of the care system. I think probably this is not unique to our region, but we get constant feedback from people in the community about the barriers of accessing the aged care system through My Aged Care, whether it's for cultural or language reasons, or people's perception that they just don't need aged care, or I just don't want to have to be assessed in that sort of comprehensive way. There are, I think there are other parts of the health system that have acted as reasons why people access high level care. For example, in our area, in the last few years, and it has changed a little bit very recently, but almost all the GPs stopped bulk billing. So the emergency department at our local main hospital became the point of contact. And so we certainly know we work with a lot of older people where their first point of contact would be to go to emergency. And if you combine some of those, that along with other financial barriers, and then just the wait times to get into the aged care system, I think we see people sort of bypassing that or not engaging in that and ending up in the healthcare system through emergency or leaving things till their situation, not accessing services early and leaving things till their situation has really become quite critical, and they end up having to move into residential care. And yeah.
Sorry, I mean, that last question, why do you think people don't access services early? I mean, you said obviously there's a barrier to my aged care, having to go through that rigmarole just to get a bus trip.
Just to go on a social bus outing, yes.
Yeah.
I think part of it is that perception that some older people have. I don't need aged care. I think that word itself is probably really inappropriate. And the whole process of having to go through my aged care, be assessed, people's concerns about, we hear many people, particularly people from CALD backgrounds, saying, I don't want the government to know my information, and that sort of acting as a barrier. I think the other reason, Marika, I think, is at times people just aren't aware of what's out there, and they become, for whatever circumstances in their life, they become quite isolated, and they're not aware of either they're not aware or factors happen in their life where they can't access some of the more healthy aging type initiatives that are out there, the things that groups and so on. But I think if you look at CHSP and people wanting to access, and the whole issue of social support, and particularly group social support, which of course provides a fantastic opportunity for people to create some of those social connections, the barriers of actually getting into it. We would have people coming to our service on a weekly basis that as soon as we mention my aged care, they go, no, we won't do that. And my response to that, and it might sound a little bit flippant, but I think it's really true, is, for example, we do bus outings to take people out for lunch with a group, build that social connection. And why do they have to go through such a complicated and quite an intensive process to go out for lunch and have a 20-page service agreement and a care plan, etc., when really what they want to do is socially connect with other people in their age group or who live locally in their community. And I think that acts as real barriers to that engagement with local opportunities.
Just going to hold you on that. I'm going to come back to talk a little bit about that, and particularly also the role of older people themselves in creating opportunities for social connection. I know that you've got a network of volunteers, so I'm just going to come back and circle back. I really want to tap into that a little bit more. Dina, welcome again, Dina Petrakis from Ethnic Community Services of New South Wales, a specialist organisation. Dina, why do we actually need a specialist ethnic communication organisation in and across New South Wales in 2020?
Thanks, Marika, and hello, everyone. Ethnic Community Services has been around since 1979, and it was actually established to support specifically ethnic communities at the time, those in the inner west being the Greeks, the Spaniards, the Italians, the Yugoslavs that had migrated here in the 50s and 60s, starting off with children's services, and then 22 years ago moving into aged care. So we provide a whole of life. You can stay with us for your whole life, from early childhood through to aging. And the reason why it is absolutely necessary, and it'll come through, I think, during the talk, is what people don't understand when we talk about CALD communities. A lot of people say, yes, they don't speak English and language is a barrier, but it's not just the language. If it was just the language, it would be so much easier. But it's the language, it's the culture, it's the systems, and it's the values. And all together, they play a critical role in how CALD people from CALD communities can connect, can engage, and can access services. So it's not just the language. And that's why with Australia's migration policies over the past 5 decades, and the growing number of people arriving from different countries to Australia, and facing the same barriers, organisations like Ethnic Community Services, and there are a lot, and they're doing great work, will always be necessary.
Yeah, particularly in a country like ours, as you said. The history of migration in Australia is well documented, and I suspect that you're seeing a lot of those 1950s and 60s and even 70s migrants now aging. Can you tell us why their needs might be a little bit different than someone that was born here and comes from, an Anglo background?
Absolutely. I don't know if their needs are different, but to understand how you can fulfill some of those needs, you really have to understand the circumstances under which a lot of those migrant populations arrived, and to understand the migrant experience. Because quite often we underestimate the negative effects of social isolation on CALD communities, and they become more prevalent as they age. First of all, let's address the issue of language. We find that generally with CALD populations, especially those migrants that came to Australia at an older age, they will revert back to their home language, either through choice or impairment. So what does this mean? This means that any disconnection or non-engagement will be exacerbated for them. And we find that they rely on ethnic radio, ethnic TV. We find families and people who know what's happening back in their home countries. They know what's happening there more than they know what's happening in their own backyard, because they do not engage with Australian media. We know that a lot of them reminisce and miss their homeland, but what does that mean in a context of aging? This means that usually it can lead to depression, it can lead to anxiety. A lot of them surround themselves with artifacts from their homeland. They're not unable to part with these artifacts, and we've seen that as some of them start to age, hoarding can also become an issue. It's not just a CALD issue, but for some people from CALD backgrounds, this wish not to let go of what their homeland is connected to their homeland and has intrinsic value can be an issue. So it could be one part of treating this issue. A lot of them, as they age, come to the realization that what might have been a temporary migration journey has now become permanent. And this means, and I'll be quite frank, they will die here and they will be buried here. Some can adjust to this, others won't adjust. They will find comfort and solace in religious institutions, in community centres, or the clubs they go to, which are reminders of their homeland. But anxiety, depression, and fear play a huge role for them, and especially regret, because their journey might have only meant to be temporary and not permanent. A lot of them have unrealistic expectations also about coming when they came to Australia. A lot of them left families and communities behind. A lot of European migrants, don't forget, also came from villages and small towns or islands. They didn't come from thriving metropolises. So not only is the context of arriving in large cities like Sydney, Melbourne, Brisbane, Adelaide, and Perth, just the context of coming from a more rural culture to an urban one was really huge for them. And a lot of them, and I know from people in my community, a lot of them still find it difficult to navigate even after all these years. And the last thing I want to say is that there's also a lot of unresolved trauma with CALD populations, particularly the ones that came over as proxy brides and grooms. in the 50s and 60s. There could have been instances of family and domestic violence which were never addressed, and that plays a huge role as these people age in terms of what I said again: depression, anxiety, fear, lack of connection, and particularly trust. Because if we don't have ethnic community services, multicultural services for these people, they will not access anything or any place that they don't trust and where they feel safe.
Thanks for explaining that. I'm going to circle back to you and to Janet just to explore a little bit about this whole issue of social connection or disconnection and the role your services can play. But Jacqui, Newtown Neighbourhood Centre has a really long and distinguished history as well. Tell us a little bit about Newtown Neighbourhood Centre, but particularly I really want to understand how inequality plays out in your service provision, how you support those people who have deep experience of inequality.
Thanks, Marika. Yes, Newtown Neighbourhood Centre has been around for more than 50 years. We're a local institution in the Newtown area, which is a very eclectic and creative part of Sydney, where we're the inner city with a capital I and a capital C. And our service delivers our centre delivers a range of different services, but a large group of the people that we see are either homeless or at risk of homelessness, including people living in boarding houses. And we have the highest concentration of boarding houses in this part of Sydney, in the country. That said, the Newtown area, like most inner city areas, particularly in Sydney, has become very gentrified in recent decades. And so what we see as an organisation is a real spectrum from very wealthy people who have bought into the area through to the poorest of poor. So people who are rough sleeping with no home, nowhere to go. And I think that how that plays out for us as a centre is a constant challenge to meet the needs of all the community. And the way that we sort of position ourselves is that we need to engage everybody to keep this community as it is, because Newtown has never become completely gentrified. It is still a warm, welcoming place for people who are homeless, who have nowhere to go, who can't access food. So I guess some of the things that we see is the significant gentrification of the area, which means people are priced out of their homes very often, or they have low housing security. And also we have long-term residents, so many of our clients are living in very expensive properties with no cash. So they're connected to the community, they've been here forever, but they don't have a lot of money. They might be on a pension. A lot of public housing developments in our area. And as Dina said, we also have a number of cold communities that access our centre. And Newtown Neighbourhood Centre, in fact, started with a Yugoslav group back 35, 40 years ago, a seniors group, which still runs today and I think still has some of the same people attending. I guess we try to position ourselves as the conduit for all of those different groups within the community. And whether that's via services and support, so things like our CHSP services, our social groups, our individual social support, our boarding house services, but also through volunteering. So for people that come along to us who, as I think Janet mentioned, need some connection but don't see themselves as old, don't need aged care, we'll often engage people through a volunteering opportunity because they want to give, they don't want to take, they want to do for, not have done for. The other way that we try to connect the dots is through donor engagement. So we will often have long-term residents here. We've got some celebrities and musicians and all sorts of people that love Newtown as it is, and we engage them to give back and to keep that local character. And a key thing that I think that as a service we've tried to focus on, and that brings all of those different groups together, is through our communities and community events and activities. So we do a number of things throughout the year through all of our different programs that brings everyone together, and often particularly our seniors who, again, don't necessarily want to be caught up with care and support, but they do want to come to the Halloween event because it's really fun and there's a sausage sizzle and face painting and there are kids. And I think that's a key part of what we do here to, I guess, retain the character of the area.
Yeah. Thank you. As you've all been speaking and looking down the list of participants, and I'm confident that you would all agree that place-based responses to what your community needs is critical. So, I could go to Newtown Neighbourhood Centre, then drive, 2.5, 3 kilometres to, ethnic community services, and then drive another, 7 Ks to see Janet in Maroubra. All of your services are different because you're absolutely responding to what your community looks like, feels like, and wants. And I'm confident participants today also shape their services around the communities they serve. Janet, Jacqui's just touched on the issue around volunteers. In fact, that's a really soft entry point for older people entering the care system. But it's actually older people seeking purpose and connection. What's your experience at J&C around that? Mute, you're on mute. Of course, famous mute.
Sorry about that. Thanks, Marika. I think, look, most of our volunteers would fall in the category of older people over 60, over 65. And I think my classic story about this is, people come into our neighbourhood centre, into our front office, and they say, I'm looking for something to do.
Mm.
And when you start to talk to them about what that means for them, they're looking for genuine social connection. They're looking to do something meaningful and worthwhile. And often a short conversation will lead to, I could try that in terms of, a volunteer role, because they don't come in thinking I'm going to give back to my community, or I'm going to, they're just looking for some form of social connection themselves. And we say that all the time. And when we talk to our volunteers about what they really value about volunteering, almost all of them will say, some people comment on, they feel that there's value in contributing back to a community that's given to them, but most of them say it's the connections I've made, it's the friendships, it's the opportunity to do something. Sorry, we're on a main road and there's sirens buzzing past.
We can't hear it.
Oh, good. I can. It's so loud. People say that, it's really, it means a lot to volunteer, but really when you scratch down, it's about the connections that provides. It's about that sense of doing something useful in the community, but mostly it's about the connections that they create. And we've also had some interesting experiences where we've had older people who've been volunteers, and they've often volunteered with us for quite a number of years, in some cases many years, and then they get to a point and they transition into becoming a client, and that transition's really pretty seamless in some ways.
Yeah. I'm going to ask everybody that's online today a really easy question. I'd be very interested to hear your feedback. Is it difficult to provide social connection under the CHSP or our new supported home program? Is it difficult for your organisation to provide it? Really interested for you to reflect on that practice issue. Dina, is it difficult for you to provide it?
No, it's probably one of the easiest things.
Okay.
We, as a CHSP provider, like Jacqui's organisation and Janet's, we provide social support groups. We provide centre-based respite. And what we find with our groups is for social support, they prefer groups to individuals. Whenever we provide social support to individuals, they actually ask us if, there's a group that they can attend, which of course, there is. So they're less individual and more group focused. We also provide ethnic specific groups like our Portuguese group, our Italian group, our Indonesian group, our Greek groups. But we also provide multicultural groups. So we find that there are people who prefer their ethno-specific because they recognize that community, the language, there's trust, there's understanding. But we also have people, we have a Frenchman who has been going to our Indonesian group forever. He doesn't want to go to any other groups. He just prefers to be with the Indonesian group for some reason. And we also have multicultural groups with Greeks, Italians, Turkish, so we provide all of that for social connection. So social connection, it doesn't matter what it looks like. It's easy to provide. People want to engage. They're the same age. They face the same issues. They can speak the same language. And it's really, really important for them because a lot of them, we find that's the only thing they look forward to, Marika. That's the highlight of their week. And when you think about it, the activity of coming to a social group means they have to get ready, they have to get dressed, they usually come by public transport. So imagine everything involved in the skills and the memory and what they need to do to get to those groups. All of it is so critical to good aging and so positive. And of course, because it's local, it's their community, it's their neighbourhood, they recognise it. I'll just finish by saying one of our social groups, the connection was so strong, they actually went to New Zealand together. Didn't invite me, but they organised themselves and took themselves off to New Zealand. Like that is how strong their connection is.
Yeah. Well, that's a great story. That's indeed. Well, in fact, I look forward to my social connection. I look forward to, meeting my friends on the weekend for our river walk or playing pickleball. So I'm sure it's a no-brainer that social connection is so important. Just online, we've got Tracy who agrees that we should 100% bring hack back. Thanks, Tracy. Abir is 100% with Dina, and that social connection is the best thing ever. There's no doubt that social connection has long, deep, lasting effects. And in fact, it's one of the key mitigating factors in terms of delaying premature or inappropriate institutionalisation. Janet, you've got your hand up. I can see I've fired you up now.
Yes, I just wanted to make a couple of comments. I mean, I agree 100% with Dina, and we've also had groups that have ended up going on annual holidays together and all sorts of things, and we've never been invited either. So, but I guess I just wanted to make a couple of comments in relation to the question you asked, Marika, about is it easy to provide social connections in the aged care system? I think it's fairly easy, and I think Dina's answers elaborate on that really well, to do that within CHSP, but I would question whether that's an inherent part of the support at home program. And I think one of the concerns I think people have is that the packages are generally used for more of that clinical type care. And often if the person has, particularly if they have some health or condition that requires a fair bit of that care, there's often no money left in the package for any services that involve social connection. And the reality is, certainly in the city where we work, none or virtually none of the supported home providers actually have the capacity to offer that sort of group service. We get many calls from supported home providers where they've got someone with a package with a bit of spare money and they're looking for something social. But generally speaking, there's not much capacity in that system to offer that. The second comment, and I wanted to just raise our 4 organisations, and another colleague worked on a research program over the last couple of years with a couple of academics looking at the whole question of social isolation and older people. And there's a quite substantive report called Older and Connected, which you can find on any of our websites. Now I've done my plug for that piece of work. But I think the other side of it, if you look at the data and the demographics in that work, one of the figures that's stuck in my mind is that 73% of older people over 65 don't access the aged care system. That means not only they're possibly not getting the care and support they need, but they're not accessing those community connection opportunities through services like social support. That's a lot of people out there. And sure, some of them are still working, some of them are, live very full and active lives. But we also know from that research that there are people in that cohort that are isolated and lonely and becoming increasingly so.
I might just jump in there because I've been busting to say that as well. I think providing opportunities for social connection as a neighbourhood centre or a place-based service, I agree with Dina. It is easy to do that. There's so many opportunities and people are very receptive. As a service system, I don't think it's easy under the CHSP necessarily because of that reason, the 73% of people who just don't want to be signing up to aged care. They do want a social connection. They want their groups. They want their friends, their trips. We've got wonderful stories of that.
You're just frozen, Jacqui.
How am I going?
Yeah, you're a little bit better, but I think, can I just say you've just honed in. That's certainly the nature of the reason I asked that question is I think CHSP and supported home, that does make it difficult. We've got a terrific comment/question from one of our participants. In fact, it's going off the Q&A. The question was really around, do you think senior centres and neighbourhood centres have kind of lost their way? They're now mostly providers of CHSP, whereas they were places where older people gathered and did things. What will it take to bring back old school local neighbourhood centres? Now, I know that Janet is on the board of the Local Community Services Association and has done a lot of work, as indeed as Jacqui and the team, around an advocacy piece and campaign piece to bring back social centres, senior centres. Do you want to comment on that, Janet?
Yes, I think so. I'm not sure that I'm going to advocate for senior citizen centres in the old model,
centres.
But the concept of neighbourhood centres and playing a role in place-based local service delivery, I think, is absolutely critical. And I think that some people would argue that there are organisations that have lost their way because they've become too big and too and not retain that place-based focus. So I think that's really critical. I think what neighbourhood centres do and can do is provide really critical social infrastructure off which other services can exist. And if you see it in that context, I think it's quite a much more powerful argument. So rather than seeing CHSP as being the service, you actually see the neighbourhood centre, and off that sits some CHSP services. And I think there are also other local initiatives, and we've just recently got involved, and Jacqui's been doing this for a while, in delivering services through our local PHN around what's called healthy ageing hubs, but promoting the concept of healthy aging and getting information out to people in the community on the diverse range of programs and activities and so on for older people. And I think, I think neighbourhood centre, I think to answer your question, Marika, neighbourhood centres just provide that really critical local social infrastructure of which programs and services like that have a community development focus as well, and can really target local older people to connect with other local older people is critical.
I think also there's a role for neighbourhood centres to be that intergenerational
Jacqui,
space.
your bandwidth isn't very good, so
okay. I'll turn my video off. Can you hear me
probably
now?
switch your camera off.
Yep.
Something's happening and you keep freezing.
Okay.
Yes.
Can you hear me now?
Yes.
I was saying that neighbourhood centres. I think that there's an important place for the intergenerational work that neighbourhood centres do. I'm not an advocate for senior centres at all. I think I'd much prefer an inclusive space that incorporates all people within the community. And I think Janet's point of, core funding for neighbourhood centres is really important in that area.
Yeah. Well, thank you. Thanks for both for answering that, and thanks for the question from the participants. We've got Sunita who's also asking, do you also include people living with dementia? And I think the answer is a simple yes. You can't talk about older people in Australia, or in fact anywhere in the world, without actually talking about dementia. As we age, the risks, or the incidence and prevalence of dementia absolutely goes up. I know we've had conversations about longevity, that we are all living longer, so we need communities that know what to do with a whole bunch of older people who want to be connected. And certainly community centres are one way to do that. Jacqui, there's a question here saying, have you found that volunteers who want to give back rather than take transfer over to accessing your services at some point, or is in fact volunteering a service type? And then we'll go to...
I would say it's a service type, because we've got an example here of a gentleman who lives in a boarding house, has been engaged with the centre for years and years. He's now well into his 80s, has had a stroke. In any other world, he would be accessing the service. He makes tea and coffee for our one-stop shop every week. And in fact, we tried to engage him in our social groups last year because he was deteriorating a bit. But his response is, that's for the old people. I don't need that. And we can monitor and keep an eye on him just as well when he's doing his job as opposed to when he's sitting in the room with the groups. So in some cases, yes, but more often than not, no. It's a service type itself.
Well said. Thank you, Jacqui. Dina, you've got your hand up.
Thanks, Marika. I just wanted to make two very quick comments on around the conversation, going back to whether social support and connection is easy to do. As I said, yeah, it is. But, as Janet pointed out, and Jacqui, and I think yourself, it's becoming difficult to do because of the systems that are being put in place and the changes. So let's be clear. I don't think any of our organisations would find it extremely difficult to do, and particularly the way we used to, and we've always done social groups. But now with a supported home, with CHSP, with the application that you have to only attend if you've got a number, My Aged Care number, and a lot of people don't want to access it, then those sorts of systemic processes make it really difficult to do what we've done easily and beautifully. That's one clarification. The second thing I want to say to the question around dementia, one of the things that we're finding with our groups and the social connectivity is that sometimes it's the groups themselves that will spot when somebody is having an issue, and they will always come up to us and say, we think Maria might be experiencing a bit of memory loss, because this is what happened on our bus excursion today. And that may be the first time it's ever been noticed, because Maria lives on her own. Her children see her once a week. So we are also privy to critical instances where aging is taking a different form. And then, we can talk to Maria, we can talk to the family, but it's the group. They become protective and they look out for each other and support each other as well. And they can give you an early indication of what that aging may look like for that person.
Yeah. So there seems to be more comments online about the importance of social connection as we all age. Is there enough research, or have we done well as service providers to actually prove that social connection investment down here really pays along the aging line? Have we done enough work to demonstrate the impact of social connection, Janet?
Look, I think at that research that we did over the last couple of years, I think was really eye-opening, but it wasn't original research. It was basically desk research to look at the whole question from a local and national and international perspective, and to try and get some good data and information about the costs of social isolation and loneliness. I think there's still room. I think there's room for more work on this, and I think there's also room for us for development, or some further development of ways of measuring the impact of local initiatives in terms of their impact on people's sense of connection, and I think it's that whole question, not just of the number of connections, but the quality and the how meaningful they are for people. Yeah. So I think it's definitely an area that needs further work.
Yeah, I think in fact this group of colleagues, and I'll come to you in a minute, was so interested and motivated to address the issue of social connection. It was really on the back of the third person, older person, dying in their apartment alone, and in our city, in a populated city, that really sparked conversations amongst us as friends and colleagues, saying, what do we need to do? What can we do differently? It is why our region has taken a firm interest in social connection. Dina, you've got your hand up, but any one of us, Jacqui, Janet, or Dina, talk a little bit about the Sydney Community Collaborative and why we tackled social connection.
I was just going to say that the Older and Connected report, which was really critical, because as Jacqui said beautifully in her introduction, this is our area, and as Janet said, this is who we are. The diversity in income, in education levels, in socioeconomic status, in everything. We coming together and working with that diversity and commissioning the Older and Connected report, there is no doubt, even the report states clearly, internationally and in Australia, studies have been done that show without social connection, people who are socially isolated have a higher mortality rate. Like, that's not something we have to prove. That's already proven. So for me, the issue is not, more research to prove what's already been proven. The issue for me is, how now do we make this a priority for government, for communities, for everyone? We know this. We know that social isolation is extremely detrimental to health. When something is extremely detrimental to health, it's going to provide challenges for health systems, all our systems. The issue for me is, how do we make this now a priority? We already know the data.
I
We
think,
have the literature.
sorry,
Sorry, Jacqui. Yeah.
sorry, Dina. Am I,
Yeah, you go, Jacqui, and then we'll go to Janet, because she's very polite, unlike you two. She puts her hand up.
I think what we do, Dina, is we need to monetize the cost of loneliness. So our work really demonstrated, more than anecdotally, but not quite as much as we'd like, the benefits of it, but we need to actually have some really hard data around what it costs not to provide social connection, the health system and the aged care system.
And I think one of the challenge, I mean, Dina, you've kind of referred to this, but loneliness and social isolation are really, they're chronic health conditions. And they're up there with other chronic health conditions in terms of impact on the health system. I think one of the challenges is because the health system and the aged care system are separate, there's no kind of looking at the whole service system, the service system as a whole, and the fact that if you address social isolation, which happens in the aged care and social and community development areas, it's actually going to have a direct benefit on the health system. There was an interesting study reported in the Older and Connected report about a town or a region in the UK where they had actually measured that, and the impact on the costs of the local health system was really significant. And I think having better data about that here would certainly help make that argument. But I agree, Jacqui.
Right.
I think
Yeah.
we need to understand the costs of loneliness, and we need to be able to put a dollar value on, if you invest this much in addressing it, you're going to get these benefits. And certainly some of the work we looked at overseas demonstrated significant returns on investment in the impact on other costs.
And some of the information out of the States was comparing the impact on the health system to smoking, saying really the impact is just as significant.
So one of the big challenges is taking that information, as we know. Just going back also to the list, some more questions coming through. Helen makes a bit of a point around local government, and do we involve and work with local government in and across our region? And I think everyone's nodding because we see them as a critical player. Local governments, again, place-based, but also obviously do things a little bit differently than their neighbouring local government partners, but they must never lose the responsibility of supporting their older people. Yeah, so there's a nod there.
We had a meeting with our local council yesterday, and we talked about where older people go and for information, and older people ring their local councils about anything and everything. So if we're arguing that the work we do in place-based service delivery around social connection is critical, then that relationship is essential.
So this is a policy, and we've got 6 minutes to go. This is a policy and practice sort of forum. Knowing what we've just talked about, and knowing the work that you've undertaken in and around this region, and all the current shifts and potential changes of CHSP, don't worry about what it's called. We're really talking about early entry care. What message are you going to give policymakers and decision makers? What are the key messages, particularly when it comes to building communities that include, that give older people purpose and give them social connection? What's our core message?
It'll save you millions down the line.
Yeah.
It's got to be easy and simple for people to access without
and equitable. Absolutely equitable.
So yes, so don't dismiss it. Are we calling for an investment in early entry care? Of course we are.
Yeah.
We're also looking for a recognition in any sort of initiative to implement it, to recognise the value of local place-based services. So we're not looking for, you know, a national program that provides something on every corner. We're looking for local responses that are tailored. And I think today's discussion sort of flagged, you know, even in our small neck of the woods, the huge diversity. And we're looking for local place-based initiatives that really respond to the older people that are in our local communities and that provide something local and flexible for older people.
And I'd say keep it out of packaged care. Social connections, not
100%.
packaged care.
No.
Packaged care is valuable and has an absolute purpose, but it's not for social connection.
Look, on that note, it's 5:56. I want to thank you all for your time and certainly to our amazing panelists. I know you're doing some good work. I know because I see you working every day. So it's terrific to have this conversation. To participants, thanks for your questions. No doubt this will be available as a recording. No one pretended that everyone knew the answers to everything, but there's a couple of key messages. And the first key message is that place-based really matters, that in fact, doing things at a local community level with your local community, with people who are aging really, really matters. Using a little bit of evidence and trying to prove up your models and your responses, Jacqui, proving that it's going to save millions, really important. The other message I think I heard from people is the interface of early entry care with other systems, healthcare systems, expensive systems, healthcare, aged care, higher level care systems, etc., carer support systems. There is a real interface, local government, and strengthening that interface is really important. Again, locally. Janet's a very big advocate of simplifying entry into any system, but particularly the aged care system. Let's stop making it so bloody hard for people to get a service and go on a bus trip and stay connected. Dina's key messages really were around recognising specialist support services, obviously for people who come from diverse cultural backgrounds and linguistic backgrounds, but also supporting Jacqui, recognising that, you know, people's socio and economic background brings diversity and we need responses that matter around that. So to keeping people out of formal systems for as long as possible. Thank you very much, Janet, for your time.
Thanks, everybody. Yeah.
And JNC for their time. Dina, same to you.
Thank you.
You very much
Thank
for
you, Marika.
your time. And Jacqui, thanks again for your
Thanks, Marika. Thanks, everyone.
Reminder that the sector support and development, sector support agencies are there to support you with a whole range of different things. So make sure you link into those. There will be a questionnaire or a survey sent out to you about this policy and practice forum. So please fill it in. Thanks for your time. Keep on doing the amazing work you're doing. I look forward to connecting again next time.